As a nurse at GPHC, you don't usually stay in one place, so you have a feel of all the areas. So, medical, surgical, COVID nurse, maternity, accident and emergency. It depends where you need it. In a nutshell, it was a fast transition, not by choice, but it's basically how nurses work. We adapt. We see the situation, regardless if our lives are threatened or not. We just fall into place because our first love is caring for persons. So for the past year, it was kind of difficult, but again, here we are standing, so we adapted. You have to be so much more aware of your surroundings and persons, and especially those with what we call like the flu-like symptoms. You would not have been aware of those in the past because it's a common cold, but now you have to be more vigilant in terms of the persons accessing the hospital. That has cut out somewhat, so that's better for us. Not so many persons milling around, just being there. But all in all, the change has been, how to describe it? Good, you should say. Depends on how you look. Depends on who's looking at it and how you're looking at it. It's been good. At the maternity section, we have the transition and the isolation unit. So if they come in and they have signs, or depends on the area that they would come from, and you suspect that it's a highly populated area with COVID patients, then there's a transition area where they go, they're swabbed, await results. If they're positive, then they go into the isolation. Depends on how far in pregnancy they are. If they're not, then they go up to the Ocean View, infectious disease hospital, Liliendal, or they go to the open ward. Outside of that, we have they come through the accident and emergency. There's a triage area there too, where they're triage in terms of checked for the infection and await results there before being sent off to whichever area. But we have nurses assigned to those areas specifically. You try not to interact too much different from the other patients, because remember, we don't want to stigmatize anybody. It's the same thing as we encourage everybody. You're hand washing, you wear your mask, all right, or you sanitize. When you're dealing with them, if body fluids have to be passed, of course you'll put on your gloves. So you don't have to be in gloves all the time, because the myth about wearing gloves is that when you have the gloves, you feel a false sense of security. Hence, you put yourself at greater risk. So you wear the gloves when necessary if you know your body fluids will be passed. Otherwise, in that, you sanitize, you hand wash, but you always keep your masks on. If they're coughing too much, then we have the N95 mask that we use. If you have to do intubation or anything, you use that mask. But otherwise than that, the regular mask, that's good. We get complaints from all over the world, fine. But I think Guyanese nurses are poorly treated compared to other countries, I guess, because of the, one for better word, lack of understanding of what nursing is all about. Yes, we like to say we're the first persons people see when they're born, babies, and the last when they die, which is truth. And even in between, then we're there to give care. And we would like for persons to appreciate, yes, we know that there are the ups and downs, the pros and cons to everything. Yes, in every organization, you have those that you would like, those that you would like, but in general, what we offer to persons, nobody else can give it, because in the pandemic, so many other persons were fumbling for their jobs, but the nurses had to be there. There wasn't a choice. We did not have a choice. We just had to fall in. We had to just get up and keep moving. And we would want to be appreciated, not just by being given items, but being respected in general. When you're speaking about nurses or nursing, if they want to give donations, whatever it is, but let it come from the heart for the love of what we do. And just to say thank you.
Amazing. Anything else?